All right, good night, everyone. Good night to the viewing audience, whether on YouTube or on Facebook. Welcome to our Men's Health Forum 101, where we'll discuss, I wouldn't say all things men, but most things men for sure. And I'm joined with an esteemed panel. I'm joined by Dr. Dwayne Archibald, Dr. Duriel Pemberton, and Dr. Randy Liburd. And so, before we go into the meat of the matter, I will ask each of the doctors here joining me this evening to just introduce themselves and bring some brief remarks.
Okay, I guess we're starting with myself. Good night to all out there, online and in the audience. I'm Dr. Dwayne Archibald. I'm actually a physician at the emergency room at Joseph and France Hospital. Also have a private family practice. I've been a physician from 2007. That's what, over 12 years now. Right, and I love medicine. My objective is just to make sure that persons are living healthy lifestyles, that persons are well. That's my main goal.
Good evening to all our viewing public. I am Dr. Duriel Pemberton. I am a general practitioner, and I work at the emergency room of the Joseph and France General Hospital. I've been in the profession from since 2018 until present.
Good evening, everyone. My name is Dr. Randy Liburd. I became a dentist in 2004. Then I went back to specialize in 2007. I specialize in orthodontics, that's braces. Before I actually went on study, I was a dental assistant from 1995 to 98, so I've been in the profession quite a long time, probably too long. And in terms of goals, is just to make sure that everybody have a beautiful smile.
All right, thank you. So before we dive into the main topics, what does men's health mean to the panel? Men health, when you hear men health, what does that mean?
Okay, so men's health may seem very discriminatory. However, if we recognize in society, mainly females tend to go to the doctor. Females take a grasp of their own health. And we have recognized, coming from the Ministry of Health that is, that we have to concentrate on the males in society because they tend not to grasp the importance of their health. Most males that go to the doctors, it's either their wives or the significant others that carry them. If you look at the incidence of prostate cancer happening in society, it's because it basically has been ignored. The males, when they see the symptoms come on, they say, okay, tomorrow that's going to disappear. Or tomorrow I might go to the doctor, and tomorrow always is tomorrow. Okay, so we have recognized that males are one of the vulnerable cohorts, vulnerable groups that exist in our society that needs to be checked regularly.
Okay, for me, male health entails all medical, psychological aspects that affect men in general, the reason behind why they're not going to see their doctor for their regular checkups, etc. Dr. Archibald would have touched on a few, but I would like to continue further by making a comparison I had with two different patients, where one was having issues with their scrotums, or the balls, as we would commonly refer to it as. And he said to me, Doc, I'm not foolish. We are of a modern age where we have different diagnostic means. I'm not going to sit there and let this get out of hand. On the other hand, I had another patient who was complaining of various stuff, including issues relating to the anus. So when I asked now to proceed now with the digital rectum examination, he was like, forget about that, deal with the rest. And so we want to pass that stage, done with the stigma, the discrimination, and create the appropriate environment so that men can come out to the different forums, go and see their doctors, and keep abreast of their health conditions all the time.
Well, in terms of oral health and mental health, you find that there's always a general phobia of someone coming to the dentist. But most of our men, because we tend to come to the dentist only when there's an acute issue. For example, only when we have severe pain, we tend to try to say we are men, so we're going to tough out the pain until it's unbearable. So there's always a link that women tend to come to the doctor or the dentist more often than men. But when they do come, it's a matter of that the issue is too far gone. It's not that they come for preventative treatment rather than curative treatment. So this has been an issue where we need to encourage women to at least come to the dentist for a general examination at least every 6 months so that they can be aware of all the issues and take the corrective treatment towards whatever issue they're having.
All right, thank you.
So, Mr. Chair, let me add another piece here, what my colleague was referring to in terms of the stigma, and that tends to be the issue with males. The stigma where if you're sick, you're weak. And we need to break that stigma. Also the stigma behind of prostate, the prostate test. Every male know about the prostate, the finger digital exam for the prostate. And there's a stigma attached behind of that to say that, I'm not doing that, I'm not doing that. So we need to break that stigma.
So I hear what is common among all of you is that men are reluctant to visit their doctors. What would you say then what should be the messaging? Should we try scare tactic? Should we just provide facts? Should we handhold them? Is it the responsibility of their peers, their significant others? What do you think needs to be done to get men in the doctor's office? Not at the last minute, but again at the stage where something can be done.
Well, through the many years that I've been practicing, what I notice seems to be working is exactly what we're doing here, education. Now, myself, Dr. Pemberton, Dr. Liburd, we all went to med school in some form or the other. The general layman has not, so they do not have that kind of information. So it's up to us to let the general public know what is what, how dangerous it is, what's the consequences, what's the situation in the chronic situation that is. So education, 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 that's where we need to start, which is exactly what we're doing here.
Apart from education, one of the most important things is health promotion. We need to let them understand that these are different avenues in order to seek information. Some persons may feel more comfortable in a private setting, in a dentist's office, all by themselves. But then we have to promote, let them know that there's access to these type of services. Otherwise, they're not going to come because they would think that, boy, if I go to the dentist might say, boy, I have X amount of cavities or X amount of teeth bad, and they might feel a bit down or depressed or shameful of how they actually keeping themselves. Because the difference between men and women tend to spend more time looking after themselves because they value beauty. But then men, on the other hand, always on the go. We never have time to actually take care of ourselves. So we need to let them know that there's access to different services in order to get treated.
What I would stress on is the same that Dr. Liburd said. In educating is creating the appropriate forum so that the men can come forward with, in a confidential setting with their doctor and lay the issue before them. The doctor has to appropriately advise them, get the necessary testing done, etc. And there are other instances where they would need to integrate the family as to what is happening, so that everyone is on the same page going forward, especially if that male has a caretaker. Okay.
All right, thank you. And just to remind the viewing audience that if you have any questions, please type it in the comment section and we will be able to answer those questions appropriately. Just some facts in doing some research as it relates to cancer. There are over 100 types of cancers in the world. In 2008, 7.6 million cancer-related deaths. There were 7.6 million cancer-related deaths. The top 4 cancers are lung cancer, stomach cancer, colorectal cancer, and esophagus cancer. 22% of cancer is contributed to tobacco use. 30% of cancer can be prevented by no tobacco, healthy diet, physical activity, and moderate use of alcohol. Now these facts, perhaps again worldwide, do they relate to our homegrown situation as well?
Yes, they do. And I have some facts here coming from the Health Information Unit at the Ministry of Health. Between 2017 to 2021, there have been 439 new diagnosed cases of cancer with an average of 88 cases per year. The top 3 with breast cancer, prostate cancer, colon cancer, and right after the colon comes skin cancer. All of these can be identified early, starting with the education, following up with the private physician or the necessary specialist, and avoiding the detrimental circumstances that can come about from it.
May I add, in relation to oral health, as you rightly said, one of the risk factors is tobacco use. But in our setting, you don't find that there's so much of tobacco use. So it's tobacco use and excessive use of alcohol. Those are the factors to getting oral cancer. Since I've been here, I haven't seen any prevalence of oral cancer, but what you find most is, in terms of oral hygiene, especially within men, is that because they don't come to the dentist, you find that they have more chronic disease in terms of gingivitis and periodontitis compared to oral cancer.
Okay. All right.
The good thing about it is that the general public has recognized the prevalence or the presence of this cancer. I mean, every year we have the breast cancer walk, and we have the different breast cancer societies that recognize that these things do happen. We even have breast cancer survivors. In terms of the prostate cancer, I mean, we had a screening check this afternoon, right? And the Rotary Club of St. Kitts also does one every year in collaboration with Dr. Thwaites. In fact, we will be having the prostate screening where we actually do the physical examination and we do the PSA blood test. And that will be happening July 16th of this year, where we welcome all males, particularly over 40. I mean, if you're under 40 and you choose to come, we don't turn you back, we welcome you. And it's a means of us to recognize, 1, the prevalence of prostate cancer, and 2, to identify prostate cancer and deal with it in its early stage.
Okay. You would have mentioned prostate cancer. Well, I did my first check today, and it wasn't bad. It wasn't bad. And so, piggybacking off of that, the Avalon Lab as well as Next Gen Lab has also come on board as relation to what we are doing here today, and say that moving forward for an extended period of time, they will conduct the PSA testing for free as well. So that is excellent news coming from the Avalon lab as well as the Next Gen lab. Now, moving on into cancer, and I would have made a post in promoting this event this evening, where there were 3 persons that stood out in our community, that's economy. One being my brother Bummers, the other Bundy, whose birthday is today, as well as Bucky, 3 Bs. And I want to ask the panel, for one, in layman terms, what is cancer? What is lupus? And what is oral cancer? Again, what is cancer? What is lupus? And what is oral cancer?
Okay, so I guess I'll take the cancer one. Usually our cells divide, hence why we grow. I mean, look at our skin. If we have abrasion, if we scrape off the skin, it's easily replaced because the skin cells are replicating. Now, the thing with cancer that each individual cell has lost its fail-safe mechanism to say, hey, let's stop replicating. So it just continues to replicate and replicate and replicate. Let's talk, for example, the prostate. Every male, the prostate grows after a certain age, but then it knows when to stop. However, in prostate cancer, this fail-safe mechanism that stops it from replicating does not exist. And the overgrowth of the cell then cause the different symptoms that we have, the blockage of the urine to pass, the pain that they have because the growth of the cells pressing against different organs. So that's basically cancer in a nutshell.
Touching on lupus. Okay. Lupus, as we know, it is an autoimmune disease in that it attacks one's body, your defense mechanism. So normally, the body has in place a defense mechanism where once you get sick, the body recognizes any sort of pathogens, that we refer to them, that causes the body to be weak in any form or the other. It immediately acts against it to defend the body. But what happens in lupus is that instead of the body producing antibodies to respond to the antigen, to those harmful ones, they are affecting the healthy cells. And so you find over time, one begin to experience various symptoms. They vary, okay? Some of them are shortness of breath, fatigue, discoloration of your digits, especially in cold climate or stress. Headaches. One of the signs that stands out is what we do refer to as a butterfly rash on the face. And so it is something, it has no cure. It's basically to treat symptoms. And so different studies are still going on for treatment. One of the causes so far is a combination of genetic in addition to environmental factors that trigger off these symptoms. The same which can appear suddenly, gradually, but over time. One time they are mild, severe, they would disappear for months, years, come back on. And then you find persons who are diagnosed with lupus have to be aware of their flares. That's what we refer to them as. So you monitor your flares. You want to make sure there are no new onset of flares, etc.
Okay, in terms of oral cancer, as Dr. Archibald was explaining, the body is made up of different cells. So in the oral cavity, they are what we call squamous cells. And like I explained in terms of the risk factors, what the risk factors do, the constant smoking of tobacco, like irritates these cells, and then the excessive use of alcohol actually dries, it causes like a decrease in salivation. So because the mouth is dried, then there's a proliferation of bacteria that actually irritates the cells and can cause the cells to proliferate and become cancerous. And you can find this cancerous lesion on the tongue, on the gums, on the floor of the mouth, in the inner lining of the cheek, and on the lips. Also, in terms of men tend to spend a lot more time working in the sun. So the direct exposure of the sun is also a risk factor for getting oral cancer.
All right, thank you. You guys would have mentioned some of the signs, right? So can you guys expound a bit in terms of some of those early detections? You see it, what are some of the red flags, the early red flags that can allow for men to say, hey, I need to see the doctor. I need to check this out. What are some of those early signs that can, save lives?
Okay, so that's a bit of a broad question, because in the case of cancer, it depends on the type of cancer. Okay, now, in terms of cancer, we also look at the incidence of the age in which these things occur. For example, males with the prostate, we usually test over 40 because we tend to see a high incidence of prostate cancer over 40. The females, in terms of the breast cancer, what was it again? It was like 30, but then we noticed that we have been seeing females at very young age starting to have signs. Now, in terms of the direct signs, males for prostate cancer, the difficulty passing urine, looking at your urine stream, if it's not going as far as it used to before, having to force to go to the bathroom to pass urine, the frequency in which you go to the bathroom, you have to go to the bathroom, you notice you're not having such a high intake of water. However, every minute you want to go to the bathroom to urinate. Now, these are supposed to be early warning signs, and if any male notice that these signs are popping up, they should immediately go to their private physician and have a prostate check done, meaning the digital check. Well, of course, the PSA would be done after if the physician sees the need. In terms of the breast cancer, we usually, I know the Ministry of Health embarked on a program where they educated young females to actually do the self-test when they go to shower to make sure that there are no lumps in their breasts. Besides touching, they also use the vision to see if there are any changes, if there are any changes in the skin, if there are any changes in the nipples, if there are any changes in the size of one breast to the other. So these are little early signs that we pick up in breast and prostate. I mean, I could even touch on colon cancer. You recognize that you go to the bathroom a certain amount of times a day. If you notice that has changed the shape of your stool, we usually encourage our patients to look at the shape and the color of the stool. I mean, most persons just sit on the toilet, get up and go, flush and go. But you have to recognize how your stool, the shape, the color, how difficult it was to come out, the frequency in which you're going to the bathroom or not. These are little early detection signs. Maybe nothing, but still better to err on the side of precaution than anything else.
Some of the signs and symptoms I would have touched on before, but in terms of why you would be thinking lupus, you have to look at one, if you would have any close family history of lupus, or two, you are a healthy individual, as in no underlying condition, yet you realize you're having some of these signs and symptoms I would have referred to, they are prolonged, they are not getting under control, that's a red flag. Visit your doctor. Because one day, ticklish thing about lupus and why it is hard to diagnose is that these same very signs and symptoms, they mimic other diseases. So while you might be thinking it is some other condition, etc., you might be having onset of lupus.
In terms of oral cancer, the most significant way is to actually have a oral examination done, because there are certain discolorations, certain anomalies that you shouldn't be worried about. Because, for example, the gums are normally pinkish, but then in our race, the melanin deposit could happen on the gum line, and your gum tend to be a bit darker, and you tend to think, oh, like, something is happening to me because my gum is dark. But then that just a melanin deposit. So there are certain conditions that is considered to be normal. So the best thing to do is to have an oral examination done, where the dentist will explain to you what they see, what they think is happening. But increase in size of the area itself, because some of the cancers are very aggressive and tend to grow very fast. For example, there was a schoolgirl where she came complaining of pain on her upper tooth. We did x-rays, nothing, so, well, we medicated her. But then the swelling just wasn't going. And it turned out that she had like cancer within the sinus cavity itself. So sometimes it's hard to detect, because like, it can be painful, but then there's absolutely nothing wrong with the tooth, but then the pain just wouldn't go away. So with further exploration and taking like different type of x-rays, then you can actually see like the mass is there. But then there's always a change in the size of the area, because the cancer tends to continue to go over a period of time. Right? So the best thing is to get an examination done so we can determine what is happening and what is not happening.
Mr. Moderator, one thing you should notice that between the answers that all three of us gave is that the diagnosis does not come around easy. And the only way how we could avoid that is to have regular checks with your physicians. For example, in the cancers, the prostate and the breast cancer, do annual checkups at least once or twice a year. In terms of the lupus, I mean, some of the symptoms, lupus is known as the great imitator, as Dr. Pemberton said, imitates many other diseases. So you need to keep on with make your doctor your best friend, make your physician your best friend. In terms of the oral cancer that Dr. Liburd mentioned, as he said, it was treated as something else primarily. And then after, when they recognized that the symptoms still persisted, I had to go back and figure out what's happening. I mean, some patients tend to be hesitant in going back to the doctor and say, oh, that doctor don't know what they're doing. But that's not the case. It's because sometimes the symptoms are not forthcoming. The symptoms are not like blam in your face. They just have to keep on it. And so the doctor and the patient have to be like partners. We have to form this kind of relationship so that me as a doctor know what's going on with you, and you as a patient making sure that myself know exactly what's happening so that the right diagnosis can come around.
All right, thank you. So piggybacking off of that point, do you think that we have enough physicians in St. Kitts and Nevis, or specialized physicians in St. Kitts and Nevis? This might be a call to persons, you know, who wants to go into medicine, to say, hey, maybe I need to specialize in a particular area. Do we have a shortage to handle the population? I know it's only 50,000 of us, but...
Well, we could never have too much physicians, so yes, we would always need more physicians, definitely. But in terms of the specialities, I do agree with you. We need more specialities in certain areas. more internal medicine. And let's be realistic. We are a small island federation. So maybe those specialists may not survive here. Like they won't have a flourishing practice. But let's take, for example, Dr. Thwaites. Dr. Thwaites is a urologist. He comes in, sees patients, and he leaves. He goes from Nevis to Antigua to St. Kitts. We can have that because we do need that here. We also have a neurosurgeon that does that as well. So yes, we do need, and we will always need. We could never have enough physicians. We could never have too much. But there's always a need for more.
Okay, apart from the issue of the personnel, I think that we need to have the right programs, because you can have the personnel, but then if you don't have the programs that guaranteed access, then patients would not come. Because, for example, you're not going to know all the specialists. You're not going to know that, okay, like this specialist actually exists, or this service is being provided at the hospital or at the dental. So we need to instill the necessary programs. So, okay, like, okay, there's a general dentist that you go and have your examination done. And then if there's an issue, then there's this person that you can actually refer. So there's a chain link between the general practitioner and the specialist, because the specialist is not going to still have the time to do the general practice, right? So there's some sort of mechanism where you can actually capture the different types of patients.
Again, that comes down to education, making the general public know that these types of doctors are available. For example, you see many patients come up to the hospital and there's something wrong with my ear. Let them know that there's an ear, nose, and throat doctor available. The same thing with chest pain. Let them know that a cardiologist is available. Kidney issues. Let them know that a nephrologist is available. It's all about the education. And again, this program is doing exactly that, the education.
All right. Yeah. You good?
No, I was going to add that in addition to screening, okay, you can screen for various conditions, and in diagnosing, capturing things early, going forward, you would realize that there would be even need for different specialists that we don't have on island as yet. So as the conditions within the population varies, they will develop needs for other specialists.
Okay. We have heard that, for instance, persons who were diagnosed with cancer and in the end didn't survive, they would have had some sort of surgery done. And to us on the outside, it seems as though that surgery made things worse. Could you clear up that for those of us who might be feeling that way, but maybe not so?
Okay. So when it comes to cancer patients, the type of cancer and the stage at which it's at would warrant necessary treatment, sometimes surgery. So that is a discussion the patient and the family have to have clear going forward. I know there are times when surgery may not be so, would give a favorable response, yet the family would go all out necessary to make sure that they did their best in providing care for their loved one.
Let's cite examples. In the prostate cancer, for example, when the whole cancer is identified, the management would be identified as 1, surgery, and 2, some form of medication. So the surgery would be done to remove the mass or the majority of the cancerous cells. And then the chemo that come after, or the radiotherapy that come after, is to make sure that there are no other residual cells left behind. But like everything in life, nothing is perfect. So the patients will need to always come back and check to make sure that it's not reoccurring, that it's not coming back. So it's not that the surgery makes it worse, it's that there's a particular type of management that's specified for each pathology, each cancer. I mean, not every cancer would require surgery. And as my esteemed colleague said, it depends on the stage. I mean, if you come in with a stage 4 cancer, the prognosis is very poor. The surgery would make no sense whatsoever. If you come in at stage 1, stage 2, maybe start on the chemo, maybe start on the radiotherapy, and maybe surgery can be used there, and that does assist.
What you also have to take into consideration, well, like Dr. Archibald was saying, is the stage at which the cancer is at, because you have to consider if there's a metastasis. So it's like, you might think that, okay, he had a surgery, but yet they haven't gotten better. But then sometimes the cancer has already spread to different organs, and we feel like the surgery is what actually made the patient worse.
Okay, so there we have it. It's not always the surgery that makes things worse, but because of the reaction of the cells as it relates to, metastasizing throughout the body. So is it fair to say then that cancer, once it reaches stage 3, is generally a faster decline? Because I've seen that through my good friend, Jamari, where, I would have seen him between a week's space of time, and it was like night and day. How does that work? Stage 1, you're moving along, everything all right, but it seems as though when the wheels start churning, it just gets downhill real fast. How does that work? And
okay, so in terms of the stages, mind you, let me put a disclaimer out there that I'm not oncologist. However, the stage classification of the cancer would depend on, as Dr. Liburd said, metastasis, which is basically a big word to say the spread of the cancer. It depends on how far it has spread, how far it has moved from the origin where it started. For example, the prostate cancer, it can spread to different parts of the body. It could spread to the bone, it could spread to the colon. And so the stages is actually a classification stating how far it has spread and hence the amount of damage it has caused. So someone with stage 1, which can easily be managed because you have a general idea of where the cancerous cells are, as opposed to somebody with stage 3 or stage 4 where you know the cancer has spread and gone somewhere else and it's a bit more difficult to control. Now, let me also add here that, like every medication, there are adverse effects. And the cancer medication tend to have some very obvious adverse effects, which is what most persons in the general public would tend to see. Yes, you're getting rid of the cancer, but the treatment does not only concentrate on the cancerous cells, it also concentrate on the healthy cells as well, which is why the side effects seem so obvious, so detrimental.
So, back on the progression of the cancers. So when this stage of cancer has been determined, what would make it advance to the other stage would be factors such as diet, environmental factors, your access to treatment. Sometimes the oncologist would have a specific treatment going forward for you. However, you may develop adverse reaction to that drug. Sometimes it depends on your setting. It is not readily available. As you know, a lot of persons, when diagnosed with cancer, they seek overseas treatment. Sometimes the cost to source these trips and treatment overseas, they are not readily available. And so in that span of time, it could progress to another stage, another 2 stages, because cancers, they are very aggressive on the body.
Based on the question that I'm seeing, what are the most aggressive forms of cancer in men, in St. Kitts? I would not say aggressive, but the most common, right? I don't want to use popular either. The most common would be the prostate, and we have seen some colon as well. So prostate would take number 1 in men, and then the colon would be right after that. And those, not really that aggressive, but like I like to tell the patients, if you have cancer today and you do nothing and you come back next year, of course you must expect that you would have deteriorated. So you need to deal with it once you find it. And there are many persons that figure, hey, let me drink some bush tea, let me do something else besides go to the medicine that is known. So there must be some progression of the cancer if nothing is done.
Also, what you have to take into consideration is the person's immune system. There's some people with a strong immune system, you stand a better chance of fighting off any illness. But then if your immune system is compromised, then that is the gateway for a faster progression from one stage to the next.
Okay, thank you. So we hear from Dr. Archibald that prostate cancer is most common. Is it the most deadliest type of cancer? Because I'm surprised to hear that prostate cancer is number 1, because oftentimes you hear men, they ain't checking on that and they ain't into them things, and you know what I mean. And it's alarming, and I think it's an eye-opener to all of us men that, hey, this is something that is most common among us, and we need to check it. We need to get, I think once men understand that it's not only affecting them as well, and this comes down to education and understanding that it changes the lives of persons who are around them as well, because now they left a family without a father figure. They left a child or children now without a father, just simply because they refuse to take a digital check. So is it the most deadliest type of cancer, or it's common but definitely treatable once one caught early?
Okay, so I would dissect that word deadliest that you're using there, because it's not deadliest. What's happening is that we tend to ignore it. The males in society tend to ignore it, all because of the stigma of the digital examination. Every male over 40, once you walk into a doctor's office, should have an annual checkup of your prostate. You should have that digital examination done. You need to have that digital examination done. And because of the fear of the stigma that comes from that one exam, we tend to miss it. Hence, that's why the numbers in the stats that we have down at Ministry of Health is that high, is because we as a population are ignoring that. The checkups from that one thing, it is a one-time stick that is ignoring. I mean, I have patients come in to me and say, okay, doc, I need to check out my prostate, but I ain't got some other way. The blood test, do the blood test. Don't, real man can't have that. And you'll be surprised the type of people that you're hearing that coming from. I mean, not to discriminate the educated or non-educated, but everybody on the same level. You need to have that test done. And that's why the numbers are high, because the test is not being done. The men are not coming and getting tested.
Got you. So let's shift gears a bit, and we'll shift gears to diabetes. diabetes, I've seen, and we're talking to both men and women here now, because we seemingly, I'm not a doctor, but it seems that we are, most persons were born with a sweet tooth. Well, I'm guilty of that. I mean, I eat cake and have drink with it. You know, so what are your thoughts in terms of diabetes? Again, some of the early signs. What are some of the preventative measures that can be taken as it relates to diabetes? What do you suggest if persons, you know, would have had some sort of generic trait as it relates to diabetes? So just share some thoughts on diabetes.
So looking at the diseases that are most prevalent, the chronic diseases that's more prevalent in the Federation, and I can even go as far as to say in the Caribbean, would be hypertension and diabetes. Now, speaking of diabetes, most kitchens and divisions, not most, a great number of us have diabetes, and we have to control this chronic disease by our lifestyle. Every time a patient comes in and I'm seeing a suggestive sign of diabetes, I interrogate, and I use the word interrogate to mention how harsh it is about their lifestyle, what you have for breakfast, what you have for lunch, what you have for dinner, how much chocolate you put down. I mean, from even when we were in Cuba, we as medical physicians identified mango season from the amount of diabetics that came into the hospital that had to be admitted. Diabetes is one of the chronic diseases that's seriously affecting our society, and it has to start with our lifestyle. Cut down the fast food, cut down the chicken and chips, cut down the chocolate. Maybe we need some other intervention here to stop us from to eat properly. And besides the diet, we have to think about the exercise. I mean, how many of us exercise daily? How many of us exercise at all? I always get the excuse, well, doc, by the time I come home from work, I'm tired and the kids on me and I have to cook dinner and I have to find time to exercise. Exercise and diet would control most of these chronic diseases to a certain extent, of course, but it needs to happen. And I think that's what the problem is right now, the lifestyle that we have.
There's a direct link between diabetes and, well, firstly, there's a saying that most of the systemic diseases, their first signs are shown in the mouth. In terms of diabetes, you tend, so what happens is because you have that happening, you find that everybody have bacteria. That's normal. What happens is you tend to have more periodontal problems, that like gum issues, dental caries, if you're diabetic. And then the connection is that because your gums are inflamed, swollen, and bleeding, let's say somebody come for like a cleaning, you find because your gum are, so it means that those persons who are diabetic, you need to actually take extra care of your mouth, come to the dentist regularly, because there's not a different type of treatment, but then we have to pay special attention to persons who are diabetic to prevent all these associated issues.
Okay. Before I continue, just allow me to answer the question on the screen. It is, do we have a urologist in St. Kitts? The answer is yes. That was one of the specialists that were recently added to the staffing at Ministry of Health. So in the future, information would be made available as to the services, where they would be conducted, and how one can access them.
So, but before you, for persons who are not, what is it? Yeah.
So the urologists deal with kidney issues, penile issues in the men, anywhere that the urinary tract is involved. Okay, that's their specialty. bladder. Yeah.
Okay, gotcha.
So continuing on diabetes, so it is one of those systemic diseases where you find there's an increased concentration of sugar in the bloodstream, okay? And you know, the blood flows all over the body, so once you find diabetes gets out of hand, you'll find it affects different organs. In terms of the signs, symptoms, you hear a patient complaining that they are having frequent hunger, thirst, urination, unexplained weight loss. Those are the four classical symptoms. You have to look at the family history. Any close family member with it, because it is hereditary as well. So if you find you have father, mother, both grandparents, siblings, you have to start looking out for diabetes, especially by age 40. There are instances where it would appear earlier. So if you have that family history, you're already seeing these signs, see your doctor. In terms of other diagnostic means, okay? So we do what we call fasting blood sugar tests, where you have to fast for at least 8 hours. You do your blood test. Once it's elevated beyond normal levels and repeated at least 2 times or more, you can say that person is diabetic. There is also the A1C test, where it measures the average sugar reading in the blood over the past 3 months. Once elevated above normal levels, that person is diabetic. We have the rapid blood sugar testing. That's the prick that we do in office or on site, wherever you are, and that's just an early indicator. The challenge with that, you'll have to factor in when the person would have last eat, okay? Because the body is designed in a way where, you know, once you eat, we get our energies from our sugars, carbs, etc. The body is supposed to eliminate that excess within a 2-hour period.
You know, what's amazing is the different ways in which we can diagnose these things from the early symptoms. I would have never thought to look in somebody's mouth to diagnose diabetes. So thank you for that, Dr. Liburd. Coming from the Health Information Unit, 3 main causes of the chronic diseases that happen in St. Kitts. The number 1 cause being cardiovascular diseases, which include heart attack and heart failure. A close second being cancer. The close third being complications related to persons that have diabetes. So diabetes is a very serious chronic disease in our federation.
Is it true that, okay, I want to draw a scenario. So you have a cup with sugar, right? You have 2 cups with the same amount of sugar. You add water to one, and you drink all of that. Is it a difference because you add water, or is it the same because you would have consumed the same amount of sugar? Is it just a matter of taste?
It's the same amount of sugar you're consuming.
Same amount of sugar. So it don't matter whether it is a Gatorade that tastes as if is diluted. Is the same.
Now what you have to look at is the amount as in the grams, however it is quoted.
Right.
So whether you have 2 grams in 10 ounces, 2 grams in 15 ounces, it's 2 grams of sugar you're consuming.
You see, we do encourage persons to read the labels on anything that they may purchase in the supermarket, because these labels tell a story. To tell whether these things are healthy for you or not, tell how much grams of fat, how much grams of glucose, and all that is very important for your health and the healthy lifestyle that we are proposing that you should have.
So then, it's not a case where you eat a big slice of cake and say, and drink some water, man, wash it down, wash out that.
Myth, that's a myth.
That's a myth. Okay. So, while we're on myths, earlier this evening or this afternoon, while we were conducting the health checks, a colleague of mine came to me and said that he heard that frequent sexual activity lowers the risk of prostate cancer. Is that a myth or something that is scientifically proven? Have you ever heard of it?
I've heard of that many times before, and there is some talk within the medical community that said that frequent ejaculation does help to keep the cancer at bay. We, however, are not promoting that you go out and have sex that frequently, but it does help to a certain extent.
All right. So, okay, any final words on diabetes as we go into our final topic, which will be hypertension?
Yeah, a lot of the issues that we face comes down to lifestyle changes. For example, one of the concerns, well, here in St. Kitts and Nevis is the sugar-sweetened beverages. Like one bottle of Coke actually contains 20 teaspoonfuls of sugar. But yet you find the children them at lunchtime, that the first thing they take. So like Dr. Pemberton was saying, that it comes down to the amount of we intake. Yeah, the Coke gonna taste cold and nice and bubbly and everything, but then the amount of sugar we actually taking while we're drinking a Coke. And these are the first, like the sugar-sweetened beverages are our first option to give our kids. So we have to try to promote like the intake of more water compared to the carbonated beverages. So everything comes down to lifestyle changes in terms of prevention of like diabetes and other chronic diseases.
So I want to touch on some of the complications of diabetes, just so that the viewing audience would know that this thing is very serious, okay? Like I made mention of, it's a elevated concentration of sugar in our bloodstreams, which both integrates all over our body. So when you look at the eyes, it is responsible for retinopathies, okay? We need our eyes, we need to cure our vision, because we don't want to be in any predicament where we cannot properly sustain our families and households. The diabetes also affects the heart. It affects the kidneys, okay? One of the structures in the kidneys that it affects are the nephrons, and so that in effect would affect kidney function in filtering the blood and toxins from the body and lead to kidney failures in the future. Diabetic neuropathy, where it affects our nervous system. So you find the diabetics, they have some loss of sensitivity to the extremities or bodies. And it's very frightening because imagine someone who is blind having a diabetic neuropathy. Something might be happening with their foot. They don't know. And it's getting worse and worse. Diabetic foot is also a serious condition that affects a lot of the diabetics, which does lead to amputation, whether it's of one or a few digits or a portion of your extremities, again, we need to be in optimum health to secure our livelihoods. And so it is not something to take lightly, because it is hard to manage for most people. Imagine every day you have to be conscious about your sweet intake, etc. Having to take this medication, pinching yourself with insulin every minute in the future from now until, I wouldn't like to be living like that. And so, again, prevention is the best way. We are educating you also, and we want you to come on board also when you're detecting having these symptoms, to consult your doctor.
Okay. One thing that you forget to mention, and this being men's health, is the erection.
Yes, the erectile dysfunction, which is of grave concern for most men. Okay, I've had cases where persons would come, could give me to fix this. The penis is not functioning the way it should. Who man would like to be living and won't be able to appropriately engage in sexual activity? And also too, for their companion, it is of grave concern, because it is something you need to engage in as well for compatibility, not compatibility, but companionship, yeah.
In my case, diabetes is something that is very dear to me. My dad, who passed, God rest his soul, he had diabetes. And diabetes does have a genetic component, so I therefore have to pay attention to what I eat. I love chocolate. I go through bars of chocolate. But seeing that my dad had that, I have to be very careful. Hey, suppose I have the genetic component. So introducing the high dosage of glucose daily, it possibly could affect me in some way. I have seen astute members of society as a child become blind, lose their limbs because of diabetes and the lack of control of diabetes. And all they needed to do was to control the lifestyle. So again, it starts with controlling the lifestyle. I saw a question come up about peripheral neuropathy. No, that's basically where the nerves in the limbs, particularly in the fingers, tend to trigger pain quite frequently, and that comes from diabetes. Diabetes gives that complication. Once the nerves are damaged, it's very hard, very difficult to control that. And that person would be on medication for a very long time, if not for life. So to say there's a cure, it depends on the extent at which the nerves are damaged. There was another question that came up. Blood disorders. What are some blood disorders? Okay, that question is a bit ambiguous, because there are a great deal of blood disorders which I don't think we want to get into. It includes sickle cell, for example. Sickle cell anemia is a blood disorder. So blood disorder is basically saying that the blood is not what we deem the normal. We have the red blood cells, they have the white blood cells, they have the platelets, and each of the cells not doing the function that it's supposed to do. That's basically what a blood disorder is.
There's a question on the screen. It is asking, what is the ratio of men to women who have diabetes in St. Kitts? I don't have the figure offhand as to the ratio, but I know it is higher in females, and that is because it is being detected in females because they would more likely to go to the doctor to get tested, etc. So there might be men out there yet to be diagnosed with diabetes and other conditions.
Does bearing of children affect that as well in terms of the higher percentage you'll see in women in terms of diabetes? No?
Okay.
I'm not quite.
So there's something called there's a type of diabetes, gestational diabetes. It's diabetes that comes on during pregnancy. Again, there's a genetic component, and the gynecologist or the obstetrician will get right on that as soon as it's identified, because it can have effects on the fetus itself. One of them being the fetus comes out extremely large, which gives difficulty during birth.
The question in relating to the topic.
Okay, the question, which is a bit straying from the topic, but what is the treatment for persons with sickle cell coming to the ER with pain crisis? Now, sickle cell basically is the red blood cell not having the shape that's deemed to be normal, and hence cause, in layman term, blockage of a lot of the blood vessels, so the tissues or the muscles not receiving the amount of the adequate oxygen and nutrients that it should. So what we actually try to do to prevent the crisis or to stop the crisis is to reverse that by, one, giving oxygen to help the red blood cells get back into the normal shape, or what's deemed normal. Two, by giving them IV fluids, because most persons that come in with crisis tend to be dehydrated. And three, of course, give them medication for the pain. So it's oxygen, hydration, and pain medication.
All right. Did we miss a question? No? No. Okay. My good friend would have mentioned in terms of, the Coca-Cola and so on. Is it, you think, that as it relates to men health, youth health, is it just education, or we need to go a bit further and say we need to put some preventative measures as it relates to laws or taxation at the borders in terms of importation? What are your thoughts, genuine thoughts, outside of the doctrine?
I'm glad you mentioned that, because there are some countries that actually ban ban cereals, those cereals with the pretty colors and with a lot of sugar. And the soft drinks, the carbonated drinks like Coke and Fanta, cannot be sold in certain countries. It's prohibited. I know there was an initiative, and I don't want to jump the gun, but between a collaboration of the Ministry of Health and Inland Revenue to have taxes put on sweet and salt.
Sugar sweetened beverages.
Right. To basically increase the price to import these kind of drinks, so that we can decrease the amount of persons that consume them, because it is affecting us.
On a national basis, there need to be policies, drawn up and actually enacted, because you're not going to get a result if you have a policy but then it's not legislated. Mm-hmm. And then, one of the beef for me is the lot of chairs outside of the schools. On one hand, you're going to say, layman terms, you can't box food out of people's mouth. But then, okay, the advantage, if I have a private clinic, then it's convenient for me. That school is also HLK means that I'm going to get more school children coming to my office. But yet, on a national level, you're actually creating more issues where your own is the best, so your natural teeth is the best. The mentality used to be that, okay, your teeth get rotten, just pull it out, you're going to go back. But then, in terms of age, we tend to mix up your baby teeth and your permanent teeth. So by the time you actually come, you're actually taking out a permanent teeth, and then that's a deformity that's not going to come back. So we need to have policies legislated and enforced in order to get these lifestyle changes to make a difference in the population.
I'm getting a message here from a very good friend that's saying that society is being encouraged to eat healthy, but the cost of fruits and vegetables are astronomical as compared to a bag of potato chips.
That is true. So we cannot approach the whole men's health or health issue in a vacuum. It has to be all-encompassing, I think. We all different players have an important role to play. And I do agree with your colleague who has stated that to eat healthy is expensive, very expensive, very, very expensive.
I mean, I do tip my hat to the vegans because the amount of money they have to spend monthly on food.
Tried it for a bit, boy, but it wasn't working out.
But the last time I checked, Ital wasn't that expensive.
Yeah, Ital. But then when persons want a variety or get, a different mixture, when they have to buy all natural this and all natural that, I mean, wild caught salmon and wild caught this, I mean, the cost definitely goes through the roof. Whereas, I mean, you could go buy any entity and get a $10 chicken and chips. Fully the same way.
$10 Chinese.
Chinese.
But yes, seriously, we as the healthcare providers have to collaborate with Inland Revenue, Ministry of Finance, your ministry as well.
Small business.
Right. To actually work with the pockets of the general public.
Well, I guess we can know this might be a perfect time for us to start to eat local, right? So there's a few questions.
Yeah, the question is xerostomia caused by diabetes? Xerostomia is actually dry mouth. Yes, it's caused by diabetes because when you're diabetic, what you tend to have is a reduction in the production of saliva. But apart from that, there are certain medications that can actually cause dry mouth too. For example, those persons who are epileptic, those medications like Dilantin actually causes your mouth to be dry. And then that's where you're going to get the gums being inflamed, the bacteria build up and have the associated issues. But dry mouth is actually one of the side effects of having diabetes.
No, I have so much horror stories when it comes on to diabetes in the emergency room. I mean, and it's the fear of taking medication, knowing you have to take medication for the rest of your life. It's the fear of feeling controlled in terms of what you eat and have to exercise every day. I mean, we need to make this a norm. I mean, I remember one guy came in, he was a Rasta, and he said he lives on the earth. He lives from the earth. And just only mango he was eating during the summer months, the mango season. And his sugar was way high. And I asked him, well, you knew you had diabetes? He said, yeah, but take bush. I mean, again, the education. I can't stress too much on the education.
All right, time is well spent, but we'll touch on hypertension, just a round robin on that, and then, of course, then we'll wrap up if we have any more questions. So you want to start, Dr. Archibald, hypertension?
Okay, in terms of hypertension, again, that runs in my family, so I know a bit about that. Personally, I had a bit of a scare with hypertension. It was coming from the COVID-19 lockdowns, where we basically were forced to live a sedentary type of lifestyle, no exercise, control a certain amount of food, coming from work tired, so you're just eating, sleeping, started to put on weight, recognized that my pressure was going up, my blood pressure was going up. It actually went up to 180 over 110. For those that don't know, the normal is 120 over 80. And when I recognized it, I say, hey, I think I'm a young guy still, and I have a few more years to put in. So control my diet, took away certain food from my diet, exercise, try to exercise like how you exercise, Dwayne. I know I can't reach your level, but hey. And I actually got it down just by diet and exercise. Now, most persons around, we see an average of at least 1 to 2 stroke patients daily in the emergency room. And it's as a result of lack of control of pressure. Most persons know that they have the pressure, the high blood pressure, but can't accept that they have to take medications daily for it. Others is just the diet. Saltfish hurting us badly. I mean, if you know what saltfish is, it's basically codfish that has been salted to preserve it for a long period of time. And persons would say, hey, doc, I soak it for 3 days, so no more salt left. That's not making sense because you're practically destroying the saltfish. So most hypertensive patients, we tend to tell them, let's leave the saltfish alone. Let's leave the potato chips alone. Let's leave the fries alone. Let's leave fried food alone. For the amount of patients this week I have told to, and I don't want to put anybody out of business, but leave KFC, leave Burger King, leave Ready Fried, leave Uncle T's. What's that one up there? Neville's, and leave Neville's alone. I mean, it's quick food, but it's fried food, and the accumulation of the fat and the salt would be detrimental to our health in terms of the high blood pressure, which would affect the brain in terms of the stroke, which would affect the heart in terms of heart attack, and which will affect the kidney in terms of kidney failure. And if you look at the comparison, to do a dialysis, you have to pay what, 300 to 400 US a session, and at least 3 times a week, as compared to nothing if you take away the salt and the cholesterol. So we have to consider what the long-term effects will be.
Okay, touching on our diet choices, you find a lot in these fast food. Sometimes there are salt added to them. We have to be mindful also of, and the MSG in Chinese food. We also have to be mindful of those foods in tins, cans, etc. that are preserved. They have a high sodium content also, okay? And some people, never mind you discard the water that they would have come in, the food items themselves already absorb that salt. That's the environment they already come in. What else can I add? To do your lifestyle adjustment. Exercise. You have to maintain ideal body weight, okay? Ideal. You have to look also at the type of work you are engaging, okay? Some work there, even though it might entail burning up calories, etc. For example, like a postman, someone in construction, you still have to find time for a bit of cardio. That's if your body could take it, eh? Yeah, because you don't want to put your body under too much stress neither. Diet in the sense that some persons, because of their work again, someone who works outdoors opposed to indoors, getting sunlight, etc., you have to consume more fruits, vegetables, so that you guarantee the body the adequate amount of nutrients it should be getting.
Okay, in relation to dentistry, this is a very, very, very important issue. Because, for example, somebody come and say, well, I have a toothache, I just want the tooth out. We tend to ask them, you have any medical problems? They're going to say, no, man, I am all right. So when we do check the pressure now, pressure sky high. So let's say we did that extraction. What would happen is that because your pressure is so high, it means that your heart like continue pumping the blood at a higher ratio compared to your regular blood pressure. So it means that even though we give the anesthetic, what the anesthetic does is, apart from numbing the area so that you don't feel pain, it contains epinephrine, which actually helps to close the blood vessel. So when the blood vessel closes, the heart have to pump harder to actually pump the blood to your body. So the heart done already overworking because your pressure is high, and now we have to like give you the medication to even like put your heart more under stress. So it's like two things will happen. The bleeding not gonna stop, so you're gonna bleed out by the time you reach AIE, or you're gonna have like a stroke or something, heart attack or something like that. So like what we tend to do is always, even though, because for example, you ask them, who is the doctor? But I don't got a doctor. The last time I got a doctor I went by Dr. Joe before he get into politics. You understand? So we got to be very, very careful. The issue is like, you want the pain to relieve, but then there are so many complications by not actually relaying the correct information to the practitioner. So hypertension and dentistry, very, very serious issue. Like we cannot, for one moment, when some person said that you cannot take too much time actually interrogating the patient to get all the information and the correct information, because that actually can save the person's life. There's always time to do an extraction. The issue is to make sure that the patient is all right before you do anything else.
All right, thank you.
I like the fact that this chart is up here. I think that every single person, every single layman should at least view this chart at least once in their life to understand what's happening with hypertension. I mean, the amount of work that went in to develop this chart, the collaboration of different organizations throughout the world, including American Heart Association. It's actually a joint national committee. This is the GNC 9, I think, where 120 over 80, 120 being the systolic, and 80 being the diastolic, that actually says that, hey, you're going into hypertension, control your lifestyle. Anything under that is considered the norm. And they actually have where 140 over 90 is where the doctor actually consider putting you on medication. So at least once in a lifetime, every hypertensive patient should view this chart.
To comment on this chart also, it is recommendable that persons who have the likelihood of getting hypertension in the future, that they are already diagnosed with hypertension, that they should aim for stage 1, okay? The reason for that is that it is something that you're going to have for life, and so what you want to is to, as early as possible, reduce the onset of certain complications that are derived from elevated high blood pressure. Sorry.
So is it a case then if one is at stage 1, can it be reduced? Can you get back down to elevated or normal, or from there it's just?
It can be reduced. It can be reduced.
Okay. Okay.
So lifestyle changes, diet, exercising, etc., is the first step in treating hypertension. Once it is not controlled by those means, then you're thinking about adding a medication or two, and the adjustment would come along depending on your figures, okay? So you can go back to a normal stage.
And you know what's great? You could tell that people are listening out in society. I mean, you bypass road 5 o'clock every morning and 5 o'clock every afternoon, and you see people walking. Mm-hmm. I mean, besides chatting, they're walking, they're actually walking, and that does help a lot. Right. I mean, a person went out and bought Fitbit. I swear quotes could say that the sales of their bicycles has increased as well. So people are listening. They just have to again, education.
Right. And in education, I've come across a lot of instances where persons would stop taking their medication on their own. Because for maybe 2-3 days, they get a normal reading, they would stop taking their medication. But the scariest part is that they do not continue with their blood pressure checks. So the blood pressure would continue to creep up eventually, sometimes get out of hand, and they don't know until they manifest certain signs.
Okay. So we're at 9:13 p.m. And so I will allow the panelists to just give some final remarks as it relates to men's health and the way forward for men on the whole.
Okay, in terms of men's health, of course, encourage all men, male figures, to come out and get checked by your private doctor. If you don't have one, find one. Do not wait for your significant other to threaten you by any means that she can to bring you out. I mean, imagine a world if you do not exist in it. If you are the father figure, if you are the spouse, if you are the son, if you are the pillar of certain person's life, I mean, get your prostate checked. Never mind the finger. I mean, I have had jokes where persons, during the whole Rotary prostate check, there are persons that walk around at each doctor and see the size of their finger to see which one would hurt less. But now, you need to get the test done. The blood pressure check, if you know you have blood pressure in the family, get it checked out. If you know you have diabetes in your family, get your sugar checked. It's very important. Again, imagine a world without you there.
So men, we are all human beings. We can get sick. And so we have to be in the best of health. We want to see our kids grow up, live their best life. And so we also have a mandate to provide for our families also. So we want to be in the best of health to do such. You've heard the information on the various topics. So you know the signs, you know when to consult your doctor. You know that you have to adhere to your doctor's instructions so that whatever condition you might happen to have, that it doesn't get out of control. And if you supposedly don't have any condition, you also have to do your annual checkup just to make sure everything is still well. And so we also would like to pass that stage where people are still being discriminated about reaching out to their physicians on certain conditions, taking advantage of the necessary examination, the DRE I'm referring to, okay? Because it's a quick means of detection as to whether or not you have the prostate cancer or any other prostate pathology. And with that, what was being made mention earlier about NextGen and Avalon Lab coming on board to provide free PCR testing, PSA testing. Take advantage of that also. It is something, as you heard, it's free. So just come on board. because we want to detect these things early o'clock to reduce our numbers of cases. And even though if you happen to have prostate cancer or any other condition, you can still live a healthy lifestyle providing you do what you are told.
It is a fact that men take the oral health for granted, and we may not aware of its connection to overall health. I had one doctor told me that as a means of motivation, is like you have a birthday every year. So as a birthday gift to you, you schedule your annual checkup with your medical doctor and your dentist. So like you always remember that your birthday is coming up, so you can't forget. Like, you know, if that is your birthday gift to you, make sure you go to your doctor to get a checkup and make sure you go to your dentist, and then you take it from there. I know we're always working because we think that we have to provide for the family, but then as a gift to you for your birthday, get these checks done so you can know what's happening, and then you take the necessary measures in order to improve your overall health.
All right, thank you. I like that. I like that. I like that. I'll use that. So, again, I want to thank the Antioch Baptist Church and Pastor Connor for allowing us his space and his means of media to broadcast tonight's session. I want to thank our panelists, Dr. Archibald, Dr. Pemberton, Dr. Liburd.
Thank you.
For ably being a part of this panel this evening, and to the viewing audience and those who are here in our midst, and for those who provided the questions. Again, men's health is something serious. It's something that we should not take lightly. It has lasting impacts as it relates not only to ourselves, but also to our families. So I implore all of us to go on out, get checked, and make sure that we are in the best health possible moving forward. I'm Dwayne Delaney, and I was your host tonight, and have a blessed night. Thank you.
Thank you.
Enjoy.
Gracias.